All right, let's jump right in, because today we are uncovering a hidden medical reality that is silently affecting millions of people. It's a topic that might seem kind of ordinary at first glance, but as you're about to see, the stakes literally could not be higher. We are talking about the critical, yet so often ignored, connection between diabetes and the health of your feet.
Just think about this for a second. Every 20 seconds, literally count to 20 in your head right now. In that short amount of time, somewhere in the world, a diabetic patient's foot is amputated. By the time we finish this deep dive, dozens of people globally will have lost a limb to a disease that quietly crept up on them, often without them even realizing the severity of the danger.
But here is the absolute game changer. 95%, yeah, you heard that right, 95% of these tragic amputations are entirely preventable if you just know what to look for. You don't need some highly advanced medical equipment at home, you just need awareness, a shift in how you view the disease, and honestly, just a few minutes of daily attention to your own body.
And this isn't just some distant, abstract problem happening to other people. To put it into perspective, in Japan alone, 1 in 5 people is diabetic or pre-diabetic. That means this risk is standing right in our living rooms. It's affecting our parents, our friends, our neighbors, and potentially us, often without a single noticeable symptom in those early stages.
And if an amputation does happen, the aftermath is just devastating. The 5-year survival rate plummets to a staggering 30%. 10 years out, that survival rate drops to between 10 and 20%. It's a grim reality for sure, but it highlights exactly why we absolutely cannot afford to ignore even the smallest changes in our bodies.
Now, those numbers are terrifying, but here is our roadmap for today. We're covering the silent foot threat, why diabetes targets feet, 5 crucial warning signs, 3 destructive mechanisms, and finally, daily prevention and care. Let's start with Section 1, the silent foot threat, or basically, what happens when we ignore small wounds.
Take a look at this comparison because it's honestly mind-blowing. A diabetic foot amputation often carries a worse prognosis than many dangerous cancers. People tend to think of a foot amputation as a tragic but, manageable lifestyle change. But the data clearly shows that a 30% 5-year survival rate is a severe medical emergency. Between 15 to 25% of diabetic patients will actually experience a foot ulcer in their lifetime, and a huge portion of those lead directly to these life-threatening amputations.
Moving right along to Section 2, why diabetes targets feet. Let's look at the anatomical reason for this. To really wrap our heads around this, we need to totally redefine how we think about diabetes. We have to shift from calling it a simple blood sugar issue to recognizing it as a disease that systematically batters your nerves and blood vessels. When you think of diabetes, you should immediately think nerve and blood vessel battered disease. It's literally destroying the delicate pathways that keep our tissues alive from the inside out.
Which begs a really fascinating physiological question. If your whole body's blood is sugary, why on earth do the feet suffer first and worst?
Well, think about gravity. Your feet are the furthest from your heart, right? So they have to fight gravity to push blood back up the body. Because of that, their dense capillary networks are the first to be shredded by these, imagine them as microscopic, jagged sugar cubes just flowing through the bloodstream. This high blood sugar damages the inner lining of the vessels, creating scabs and hardening the arteries. Those incredibly fine capillaries in your toes just cannot withstand the constant internal scratching. So oxygen and nutrients simply stop arriving.
Okay, Section 3, 5 crucial warning signs. These are the red flags to watch for.
Warning sign number 1 is a really bizarre change in sensation. People often just brush it off as getting older or being tired, but you might feel this weird tingling or what some patients describe as feeling phantom socks, literally feeling like you're wearing socks even when your feet are totally bare. Or you might feel like there's a thin membrane stretched over the sole of your foot. That is early-stage nerve damage right there.
The second sign is a totally visual cue. If your toes look noticeably pale or start taking on a blue or purple tint, it means the blood flow is essentially suffocating. Healthy feet should have a natural pinkish hue, right? When they turn pale, blood is struggling. When they turn purple, you are looking at a severe, dangerous blood flow blockage.
For the third sign, I actually want you to literally reach down and touch both your feet right now. Seriously, do it. Is one drastically colder than the other? Unexplained coldness, particularly a stark temperature asymmetry, where one foot is warm and the other is just freezing, is a major red flag that circulation has broken down in that specific limb.
Sign number 4 transforms a completely harmless scrape into a ticking clock. We're talking about a tiny cut, failing to heal even after several weeks. In a healthy person, a small scratch heals in a week, but when your capillaries are destroyed, your body cannot deliver the necessary immune cells to fix the skin. A tiny 5mm scrape can actually reach the bone in just 2 weeks if left unchecked.
And finally, sign 5 highlights how the disease physically warps the foot's shape. As nerves die, the muscles in your feet behave differently. This leads to hammer toes, flat feet, or severe bunions. And because you can't feel pain properly anymore, you just keep walking on these new uneven pressure points, basically grinding them into massive sores.
Which leads us to section 4, 3 destructive mechanisms, or the deadly triad.
This is how these 3 elements combine to turn a tiny blister into an absolute medical emergency. It's a trap. First, neuropathy. Your destroyed nerves mean you simply can't feel the cut on the bottom of your foot. You could step on a tack and not even know it. Meanwhile, restricted blood flow guarantees your immune system can't arrive to fix the damage. And finally, chronic inflammation means your body's overall defense systems are globally weakened.
So the absolutely crucial point here is that a minor cut becomes an all-you-can-eat buffet for bacteria, accelerating necrosis rapidly. Not only is your immune system missing in action, but your sugary blood provides the ultimate fuel for the infection to spread like wildfire. Even antibiotics struggle to work because, well, there's no blood flow to carry the medicine to the actual wound.
Okay, final section, number 5, daily prevention and care. Because the good news here is that the power to stop this chain reaction is entirely in your hands.
First, looking at the root cause, keeping your HbA1c, that key blood sugar metric, consistently below 7% will miraculously slash your risk of foot complications by over 70%. It's not about just eating well for one day, it's about sustained, long-term control over months and years.
But the true defense lies in surprisingly simple daily habits. Since you might not feel pain, grab a hand mirror every single night and just visually check the bottom of your feet and between your toes for cuts or blisters. Always wear properly fitted shoes. Give yourself about half a centimeter to a full centimeter of toe room so nothing rubs. Moisturize daily so your skin doesn't crack. But, and this is key, keep the spaces between your toes completely dry to starve off fungal infections like athlete's foot. And finally, cut your toenails straight across, not rounded. That prevents ingrown nails that can so easily open the door to a devastating infection.
I want to leave you with this final, provocative thought. Your feet carry you through your entire life, so are you giving them the daily attention required to save them? We spend so much time worrying about our hair or our skin, but it's the simple, everyday act of just looking at the soles of our feet that can quite literally save our lives. Take a moment tonight, check your feet, and empower yourself to stay healthy.